This is one of the very important remedy for hemorrhagic tendency. We have got several drugs for hemorrhagic tendency like phosphorus, sickle core, lachesis, ipecac, carbovage. But characteristic of hemorrhage of this drug is hemorrhage is very dark in color. The hemorrhage is non-coagulable and it is highly offensive in nature. There's hemorrhage from every orifice of the body. Hemorrhage from the eyes, hemorrhage from the nose. Females will have a vicarious menstruation, hemorrhage from the ear, hemorrhage from the mouth, even the hemorrhage from the skin, even the sweat, which has got a bloody in nature, bloody sweat. This is the characteristic of this drug, which is non-coagulable, highly offensive and dark in nature. This is a remedy predominantly right-sided affection. This is not lycopodium, or this is not bryonia, or this is not chelidonium. It is an excellent remedy for malignant dyscrasia, the person who has a tendency for malignancy, malignancy of the throat, malignancy of the stomach, or malignancy of the uterus. This is not carbo animalis, this is not coniameculum, this is not asteria rubens, this is not carcinosum. It is an excellent remedy for the person who is having a tendency for jaundice. The skin is yellowish discoloration. And it is not just jaundice, it is said that malignant jaundice. So much progressive jaundice. So this is not again chelidonium, this is not Cardus marinus, or this is not lycopodium, or this is not Carica papaya, or this is not bryonia. This is a remedy for the females who have got marked vomiting, especially at the time of menses. She is only better, or she cannot lie on her back, or she cannot lie on her any of the parts until and unless she vomits out. The moment she vomits, she feels better. Like that vomiting amelioration you see in Noxomica, but this is not Noxomica. It is also very important remedy for the person who has got diarrhea. Diarrhea is like a gushing, jetting out, highly offensive, brownish in nature. This is not Crotalus, this is not Thuja, this is not Jatropa, this is not Jalapa. This is also indicated for the person who has got a recurrent tendency for boils and carbuncles, which is highly offensive and bleeding, and this is not our sickle core, or this is not our silesia, this is not sulfur. This is a remedy, belongs to the family of snake venoms or snake kingdom, or this is a remedy, we call it as a Crotalus Horridus. Crotalus Horridus. This is a drug prepared from the snake venom, commonly known as a timber rattlesnake, belongs to the family of Crotalidae or Viperidae. This snake is found naturally in North America. The medicine is prepared from the venom of a rattlesnake, which has been triturated with sugar of milk. And again, this drug has been proved by Dr. C. Herring. In the year 1837, he has been assisted by 5 other provers. Very often in homeopathy, we always give importance to Dr. Samuel Hahnemann, and very often we neglect many of the stalwarts like Dr. Herring. If you know Dr. C. Herring, we can say that he is a dare to be wise. He had that much boldness and that much courageous to prove poisons. Not only on provers, but mainly to on himself. His great contribution like lachesis, which is the deadliest snake venom during his time. Then we have the drug called Crotalus, the rattlesnake venom, he proved. Not only the snake venoms, he proved the Apis mellifica, he proved the rabies, saliva of the rabbit dog, which is again one of the most deadliest disease. Once the person who is getting rabies, it is very difficult to cure. But still he had that boldness to prove the saliva of the rabies dog, and he got the beautiful drug picture, lysine. Not only that, during his time, there are so many sexually transmitted diseases like gonorrhea, and he proved many of the nosodes. So this is a short contribution of Dr. C. Herring. We must remember him for his greatest contribution in the field of homeopathy. Crotalus is a genus of venomous pit vipers in the family of Viperidae, which is commonly known it as a rattlesnake or rattlers. You can see the picture of the snake in this slide. Looks like any other normal snake, but you have at the tail end you have got something which is like a flag which comes upwards. It is something which rattles when some enemies or comes nearby. This snake will start shaking that before attacking on the prey. This genus is found only in the America, from the southern Canada to northern Argentina, and member species are colloquially known as rattlesnakes. The generic name Crotalus is derived from the Greek word crotalon, which means rattle, which refers to the rattle on the end of the tail, which makes this snake is different from any other snake. So whenever something comes which will start rattling, it is called horridus, which is again derived from the Latin word horridus, means a dreadful, means highly poisonous. Since it is a variety of vipera, so it has got a hemotoxic poison. It has the property of destroying the platelet and leading to hemorrhage. As you can see in this image, it is also called as Canebrake rattlesnake or banded rattlesnake, which is a species of venomous pit viper which is endemic to North America. Because it is an endemic in North America, it is also called as an American viper. It's also called as an bustard rattlesnake or black rattlesnake or eastern rattlesnake or great yellow rattlesnake or mountain rattlesnake. So there are several names for this particular snake. The timber rattlesnake was one of the many reptile species which is originally described by Carl Linnaeus in the landmark 1758. Adult snake can grow up to 36 to 60 inch in length, and this rattlesnake lives in forest, rocky and hill areas. Regarding the sphere of action of Crotalus Horridus, just like any other snake venom, this medicine also has got an action on blood, it has got action on the liver, it has got action on the heart, it also has got action on cerebrospinal nerves, a special affinity on the throat, and action on the occiput, and predominantly it has got action on the right side of the body. By action on the blood, this will start hemolytic property. It will aggregate the platelets and start bleeding. By acting on the cerebrospinal system, this will produce symptoms like meningitis, symptoms like encephalitis. By action of this drug on the liver, which will produce symptoms like jaundice. It is mainly because of it has got hemolytic properties, and it will produce a hemolytic variety of jaundice. Regarding the adaptability, for whom this drug is adapted. This drug is mainly adapted to the individuals who are so much debilitated, who have constant hemorrhages. Hemorrhages are every orifice of the body, the person is bleeding. Bleeding from the nose, bleeding from the eyes, bleeding from the mouth. But this is not like any other remedies which is bleeding, which is non-coagulable and which is very dark and which is highly offensive. Such type of bleeding, this drug is adapted. adapted to the people who have got low vitality, maybe in conditions like septic conditions. It is also adapted to the old aged nutritional troubles. Adapted to the people who have a dark complexions and they have got a besotted face, looks like a drunkard, like that of Baptisia, like that of Gelsemium, Stramonium. It's also adapted to the individual who are prone to have apoplexy, a kind of a stroke, or people who are prone to have a convulsions. So generally their skin looks very yellow and dirty and highly offensive. This is the adaptability of Crotalus Horridus. Let us see some of the keynote indication of Crotalus Horridus. The first and the most important indication of Crotalus is regarding the hemorrhagic tendency. Hemorrhage from every orifice of the body. Even from the pores of the skin it will start bleeding. Hemorrhage from the gums, hemorrhage from the nose, hemorrhage from the stomach, hemorrhage from the lungs, hemorrhage from the urethra, hemorrhage from the womb, and even the hemorrhage from the bowels. But the characteristic of hemorrhage of Crotalus is very black and which rapidly decomposes, like that of anthracinum. The blood will be exudating from even the eyes, like that of arnica, like that of bothropes, carbovage, lachesis, phosphorus. Even for the retinal hemorrhage, you can think of Crotalus Horridus. Here the characteristic of hemorrhage is very dark and which is non-coagulable. Now we may be wondering, we have got several drugs for hemorrhagic tendency like lachesis, like phosphorus, like sickle core, carbovage, ipecac, irigeron. So there are several drugs. Now how to differentiate in our day-to-day practice? It is very easy. We have got generally some drugs called arterial bleeding and we have got some drugs called venous bleeding. Here the arterial bleeding means the blood is bright red in color, which is commonly seen in drug like phosphorus, drug like ipecac. The bleeding is bright red. At the other end, we have got venous bleeding, where the bleeding is very dark and clotted blood, like that of lachesis, like that of carbovage, like that of sickle core, where the bleeding is dark red. But here, in Crotalus, it is not only dark, but which are non-coagulable, which is constantly oozing. And again, it is not only dark and it is not only non-coagulable, but it is highly offensive. So these are the three things which makes uniqueness of Crotalus Horridus. One is, which is a dark, second it is non-coagulable, and third it is offensiveness. That is how you can differentiate hemorrhage of Crotalus Horridus from the other drugs. Now you can imagine the bleeding is, even the sweat, which is a bloody sweat. The sweat will be staining the cloth like a blood. We have other drugs also, curare, an arrow poison. We have petroleum, lycopodium. So these are the other drugs where the sweat has got a blood color. And even the skin, there is a purpural hemorrhages, which comes on suddenly from all the orifices. And even purpural petechias, like that of sulfuric acid, like that of arnica. So there is a bleeding from the skin. Even not only bleeding from the skin, even the females, they have got vicarious menstruation. Instead of menses, they have a bleeding from the other orifices. Now, difference between lachesis and Crotalus Horridus in bleeding. It presents somewhat similar picture that you get in lachesis, but here the characteristic of hemorrhage is little different and it is more qualified. That's how we can differentiate the hemorrhagic tendency of lachesis and hemorrhagic tendency of Crotalus. The second keynote indication of Crotalus Horridus is regarding the prostration. The person is having marked weakness or marked debility or marked prostration. there is a sudden and great prostration of vital forces, as you see in arsenic alb, as you see in camphor, as you see in carbovage, as you see in phosphorus, as you see in sickle core. Every drug has got prostration, or every drug has got weakness. Here, especially in bilious remittent fevers, or so-called yellow fever, or so-called a jaundice, or so-called a typhoid fever, or so-called a malignant blood diseases. In such condition, the person is so much prostrated, there is a sudden collapse, where the person is vomiting a black vomitus, and person is having bleeding from the every orifices, and he is almost going to be collapsing. Where the pulse is very rarely palpable. It is, you can say that pulse is not able to palpate, where the person is sinking down, person is going to collapse. Associated with jaundice, associated with typhoid fevers, associated with other malignant blood diseases. In such conditions where the person is having weakness, you can think Crotalus Horridus. Maybe you can think this Crotalus Horridus in dengue, where the person is having severe fever and person is almost going to collapse with bleeding from the orifices, with purpura, petechia, where you can beautifully, this drug has cured several cases of dengue. You need to differentiate the weakness of arsenic alb, weakness of camphor, weakness of carbovage, weakness of phosphorus and sickle core. Arsenic, the person is very restless with marked prostration, where especially aggravation in the midnight, where you can differentiate arsenic alb with characterized concomitant thirst. Carbovage is again in the end stage of disease. In old individuals are full of venous constitutions, and person is having cold sweat, and person is wants fan. Phosphorus is again, the person is very chilly with burning, with the emptiness and sinking down sensation, is again bleeding is a bright red in color. That's how we can differentiate the weakness of phosphorus, carbovage, arsenic alb. The third indication about Crotalus Horridus is regarding the most of the complaints are right-sided affinity. We know that the snake venoms or the drug prepared from the snakes, generally they are a left-sided remedy. For example, lachesis is a left-sided remedy. But this is a drug just opposite of lachesis. That is, most of the complaints, they were right-sided affinity, right-sided headache, or right-sided chest pain, or right-sided abdominal complaints, or right-sided joint pains, where the remedy is Crotalus Horridus. There are right-sided several drugs, but I am speaking only related to the ophidian group or related to the snake venoms. This drug is mainly a right-sided remedy. Crotalus is also indicated for jaundice. It is not just jaundice, it has been described as malignant jaundice. That means it is a complicated jaundice. For the jaundice, we have got several drugs. The most important drugs like chelidonium, we have got Cardus marinus, we have got digitalis, we have got phosphorus, we have got bryonia, we have got carica papaya, we have got sepia. So there are several drugs, but the important of the jaundice in Crotalus, it is mainly because of hemorrhagic reason. It is not the hepatic cause here. It is mainly because of hemorrhage that break down the hemoglobin and that leading to jaundice. We have got drugs for obstructive jaundice, like as you see in Berberis vulgaris, or you can see in Dolichos. But here the mainly because of hemolysis which leading to jaundice, where you can think Crotalus Horridus, where the person is sinking down, where the person is bleeding from all the orifices and person is so much weak. Another indication of Crotalus regarding the cerebrospinal meningitis. Here, for the meningitis, Crotalus is not the first choice of remedy, but whenever some diseases, maybe you can think of in dengue, or maybe you can think of jaundice, or you can think of hepatitis, which is crossed and reading affecting the complication to the brain, where you can think Crotalus Horridus could be a choice of remedy. For the generally meningitis, we have got drug like belladonna, we have got drugs like veratrum viridae, we have got remedies like stramonium, we have got remedies like hyoscyamus. They got beautiful indication. Here, It's mainly a cerebrospinal meningitis with septic fevers, where you can think a Crotalus horridus could be a remedy. Crotalus horridus is also indicated for vomiting. The vomiting is yellowish or bilious with anxiety and weak pulse. Now you may be thinking, for the vomiting, why we should think Crotalus horridus? Vomiting means we have got Noxomica. Vomiting means we have got Ipecac. Vomiting means we have got arsenical. Vomiting means we have got Bryonia alba. Why the Crotalus horridus? But Crotalus horridus is vomiting especially during the time of menses. Every month after menstruation, she cannot lie on her right side or she cannot lie on her back without instantly producing a dark green vomitus. So that is a quality and that is a qualification of Crotalus horridus. Every time, whenever she is having menses, she cannot lie on her back or she cannot lie on her right side, except she must vomit. The bilious vomiting, it should be which is a dark and green and offensive. Then she feels better. So that is the qualification of vomitus of Crotalus horridus. In lachesis, you know that she feels better by menses. Here, she feels better by vomiting. That's how you can differentiate Crotalus and lachesis in female complaints. Crotalus is also indicated for diarrhea. For the diarrhea, it is very profuse, which is very putrid with a great force. Now, several other drugs come into our mind for the putrid with a great force diarrhea. Remedies like Gambogia, remedies like Crotantic, remedies like Gratiola, remedies like Sickle Core, remedies like Podophyllum, remedies like Thuja. But the characteristic of diarrhea in Crotalus, which is very black and which is very thin, like a coffee ground, which is highly offensive, especially associated with yellow fever, maybe associated with cholera, maybe associated with typhoid, maybe associated with septic fevers, or maybe associated after bad food or bad water. That's how we can differentiate of Crotalus horridus diarrhea with other remedies. Crotalus horridus is also indicated for headache, especially headache on right side of the body, where the person must walk on tiptoes to avoid jarring. Slightest jar will aggravate the Crotalus horridus headache, just like our belladonna, like bryonia. Slightest jar and jerk is aggravation. Here, in order to avoid jarring, the person must walk on the tip of the toes. That gives relief. Crotalus is also indicated for diphtheria. You can see in this image, diphtheria is almost eradicated. I have never seen any case of diphtheria in my practice, but still it is a remedy for diphtheria, especially a malignant type of diphtheria. Malignant type of diphtheria means a complicated variety of diphtheria where there is a person is having bleeding from the nose, there a person is having bleeding from the mouth, associated with edema and gangrene of the fauces or gangrene of the throat or gangrene of the tonsils, where Crotalus horridus is indicated for malignant diphtheria or complicated variety of diphtheria where the person will be having bleeding from the nose, mouth, or gangrene of the throat or gangrene of the tonsils, where the pain, which is aggravation from empty swallowing, associated with vomiting, associated with weakness, associated with diarrhea, you can think of Crotalus horridus. Crotalus is also indicated for the people who have got tendency for carbuncles, or the people who have got tendency for blood boils, or the people who have got tendency for gangrene. Now what you can see in the image of a pus pocket. A carbuncle means a variety of septic conditions where the cluster of boils with a pus pockets around, which is generally caused by Staphylococcus aureus. A boil is a single, but here multiple boils, which is cluster of boils together with a pus pockets inside, where you can, that is called a carbuncle. The carbuncle or a blood boils or a gangrene which is surrounded by purple discoloration, which is surrounded by edema with burning sensation. There's a severe violent pain and oozing of highly offensive discharges makes this drug unique from other drugs. We have got several other drugs for boils. We have got several other drugs for gangrene. The remedies like silesia, remedies like heparsulf, remedies like pyrogenum, the remedies like arsenical, the remedies like sickle the remedies like arsenical. Each one has got its own unique points. Now, coming back to Crotalus horridus, here the uniqueness is more of complicated variety. It is not the initial part of boils or initial part of gangrene. It is almost complicated, almost pathology is advanced, where the person is so much prostrated, the person is so much weak, there's a full of oozing, which is highly offensive. You can think of Crotalus horridus. It's also indicated for the people who have got a tongue which is fiery red. The tongue is very smooth, as if polished. The tongue looks as if varnished. All the papillae are disappeared, which is a unique sign of Crotalus horridus. We have got several other drugs for this tongue. The remedies like pyrogenum, the remedies like terebinth. Now, the tongue is a clue for most of our prescriptions. We have taken the detailed case and final to differentiate one drug from other drug, we look at the tongue. For example, rustox. Rustox has got a red triangular tip. We have got natramur or taraxacum, a so-called geographical tongue, a so-called mapped tongue. We have got most dirty tongue you see in natrum sulf. We have got posterior part of the tongue which is coated you see in naxomica. We have got whitewashed tongue, as if the tongue has been coated whitewash you see in antim crudum. And the center of the tongue is red and surrounded by white you see in antimonium tartaricum. You have got a clean tongue you see in cinna. So this is how you can differentiate a clue, and the tongue is a sign of prescription. Next indication, probably this is the most commonest indication you may think in future days, that it is a remedy for the bad effect of vaccination. Now everywhere vaccination drive is going on, but whenever the complication of vaccination, we have got several drugs. The most commonly used drug like Thuja, which is generally used for the bad effect of vaccination. Then you have got remedies like silesia, where the vaccination leading to abscess formation, where you can think of silesia. We have got antimonium tart, vaccination leading to complication to the respiratory system. You can think of antimonium tart. Here, vaccination, after vaccination, person may be having bleeding. A person may be having a marked weakness. A person may be having sinking down. Then you can think of Crotalus horridus. It is not only for the bad effect of vaccination. Crotalus horridus can be thought of for insect stings, like our ledum pal, like our Apis mellifica. For also the bad effect of dissecting wounds, like that of arsenical, like that of pyrogenum, like that of anthracinum. Another indication of Crotalus and most of the snake venom remedies, we have this symptom. It is a remedy for menopausal aliments, where the person will have intense flushing, where the person will have drenching perspiration, person will have fainting spells and sinking down at the stomach, with prolonged metrorrhagia, where the characteristic of the bleeding is a dark, highly offensive, with profound weakness. Now, how to differentiate menopausal elements of lachesis and menopausal elements of Crotalus? As we know, basic difference is both looks very similar. One is right-sided, another is left-sided. The complaints will be on the left side, you can think of lachesis, where the complaint is right-sided, you can think of Crotalus. And more weakness, more prostration, you can think of Crotalus. Less weakness, less prostration, you can think of lachesis. Again, lachesis has got peculiar mental features, where the person is too much talkative. Person cannot wear anything tight. There are so many other symptoms which make you to prescribe lachesis, whereas Crotalus has got less such symptom. Here, more of weakness or more of prostration, more of non-coagulable blood, more of offensiveness, more of sinking down, you can think of Crotalus horridus. Crotalus horridus is also indicated for many of the malignant conditions. Generally, the people who have got more prone for malignancies, malignancy of the uterus or malignancy of tongue, or malignancy of stomach, or malignancy of skin, where the malignancy of liver, where the person is so much weak and person is having a tendency for hemorrhage, the dark black fluid. In such conditions, this remedy can be thought of in malignancy. Now for the malignancy, there are several drugs like conium maculatum, carcinosin, carboanimalis, asteria rubens, condurango. So each drug you need to differentiate based on the pathology. Here it is a generalized remedy which has a tendency for malignancy with peculiar concomitants like weakness, dark oozing of blood which is non-coagulable, especially on uterine malignancy, maybe of liver malignancy, maybe of throat malignancy. You can think Crotalus Horridus. Another indication of Crotalus is loquacity. Loquacity, several drugs are there: stramonium, agaricus, hyoscyamus. Here, loquacity with desire to escape. In lachesis, the person is shifting from one topic to another and person is almost adamant on speaking. That is lachesis. Here, with the loquacity, person has a desire to escape. Then you can think of Crotalus Horridus. Few more indication of Crotalus. The Crotalus person is too much hungry. Person craves for stimulants, craves for sugar, craves for pork, and person has got aversion to meat. Now, craves for stimulant, you have got several drugs like sulfuric acid, coffea cruda, you have got naxomica. Craving for sugar, you have got remedies like medorinum, you have got remedies like sulfur, you have got remedies like silesia. Another indication of Crotalus is indicated for the people who have got tendency for convulsion. With almost common symptoms are there. This is not the first choice of remedy for convulsion, but it can be thought of person who has a tendency for convulsion with the trembling of limbs. There's a foam from the mouth with the delirium tendency and teeth grinding, especially the person associated with other diseases, maybe associated with meningitis, associated with encephalitis, associated with malignancies. In such condition, the person is having convulsions, you can think of Crotalus Horridus. Generally, we have got several other drugs for convulsions like naxomica, Ethusa cyanapinum, Cupra metallicum. So that like that we have got several drugs, but Crotalus Horridus is not the first choice of remedy. Here you can think indicated for convulsion associated with other diseases. We'll see about the modalities of Crotalus Horridus. Crotalus gets complaints mainly after hemorrhage, complaints after diphtheria, complaints after blood poisoning, complaints after jaundice, complaints after typhoid fever, complaints after dissecting wounds, complaints after insect stings, complaints after vaccination, complaints after septicemia, complaints after suppressed menses, complaints during menopause, complaints from exposure to sun, complaints from fright, complaints from lightning, and also complaints from alcohol and foul water. So there are lots of etiology, and you have got many drugs coming close for each of these etiology. For example, hemorrhage means you can think of many of the hemorrhagic drugs. You need to differentiate. You need to differentiate blood poisoning like baptisia, arsenic alb, echinacea. You need to differentiate for jaundice. You need to differentiate typhoid. Now regarding the aggravation and amelioration, generally aggravation by slightest touch, slightest jar, especially headache is aggravation by slightest jerk and jar, aggravation by movement, aggravation in the spring season, aggravation by alcohol, and aggravation by lying on the right side. Since they are hot patients, so they got aggravation by warm weather, aggravation by wine, aggravation falling to sleep, and they also get aggravation in the damp, wet weather, aggravation open air, but head and stomach symptoms are ameliorated by open air. They are generally ameliorated by light and ameliorated by movement. We will try to understand the Crotalus Horridus personality. So mainly the person is in a state of delirium, a low form mentally, a low form of delirium. The person is muttering, person is talking to himself, which is a peculiar form of loquacity. Here it differs from the lachesis loquacity. Both are the remedy for loquacity. The lachesis loquacity is so rapid that if anyone in the room commences to tell something, the lachesis patient will start finishing the story. Although he has never heard anything about it, in lachesis person is so active in his mind. She is so active in his thought and she'll keep on talking and she is jumping from one topic to another. No one is permitted to finish a story in the presence of lachesis patient. One will commence to tell something, he will say, "Oh yes, I understood it," and he keep on talking, and there is a person is jumping from one topic to another topic. That is the peculiarity of loquacity of lachesis. But Crotalus is little more different from that of lachesis. Crotalus will take it up and he'll be mumble and he stumble over his words. He is not so much fast and quick in talking as that of lachesis. In Crotalus, the person is talking in a clumsy manner. The talking is in a form of low, passive state, like as if he's been intoxicated, as if she's intoxicated, such kind of loquacity. In lachesis, you can see a wild excitement, whereas in Crotalus, you can see a passive state, as if she's been intoxicated. So more of delirious talking. Person is so much drowsiness, like that of gelsemium. The person is so much stuporous condition, that of baptisia. Further qualification of loquacity of Crotalus is loquacious delirium with desire to escape from the bed. It is passive. His motions are slow, more of muttering deliriums, more of muttering loquacity you can think of Crotalus. Associated with, the person is so much sadness, person is so sad, person is feel like crying, he moved to tears by reading, person is in a state of melancholic and timidity. Associated with that, the person is also a fearful, person is also a anxious, associated with person is having a cold sweat. Sometimes the person becomes so much irritable, sometimes the person becomes so much cross, and he get annoyed by each and everything. So this is the peculiarity of Crotalus Horridus mind. Person is so much sad and he thinks of death. Person is so much weaky. Person is so much melancholic. There is a weak memory. He makes mistakes with full of clouded thoughts. He forget the things while writing. He forget the things while going to shop. He is having a suspiciousness, which is very common to many of the snake remedies. Suspicious about friends. Feels that he has been surrounded by animals. So these are the few of the mental state of Crotalus Horridus.